in this area, because in the demo sometimes I cannot show everything, but you can see what's possible to do with the body work while you're doing the breath session, and then you can implement some of it. Is it okay for you guys?
Yes.
Yeah, it's okay. We do some body work first. So come lay down, face up, whichever is comfortable. So a few things you could do. Maybe I just recap yesterday, because in yesterday's session you work with the eyes, but after this movement, what's nice to bring some body work. Gitan was showing a little bit like stretching the eyebrows, so you can use quite firm pressure, but bear in mind that the skull can hold some trauma. So if you come with the touch in this area and you see that the person goes into the freeze or they tense up, means that this is too much. So then you renegotiate the depth of the touch so it's comfortable. Usually nice, deep, firm, like kind of stretchy touch in this area is very nice. In the forehead. And you can sometimes ask also, how does it feel, Mariam?
It feels nice and maybe even be firmer.
Could be firmer. So you can even, yeah.
It's also because my head goes in the mattress.
Yeah. Okay.
So it's really stretching. It's really.
You could work on the temporal bones, yeah, here on the side, kind of stretching a little bit. That's where sometimes people with migraines or headaches touch themselves. There's a muscle on the temporal bones, and they do this, and this is simply to discharge the muscle. So you can also like stretch, and you will be in the hair area, so you need to be soft so you don't pull out the hair. But you stretch this area. This is nice in this area.
That feels really like
like something is relaxing. So you get a soft touch, and then you can pull, push. Nice way sometimes to bring like fingertips and press with the fingertips on the sutures. There's a lot of different bones, frontalis, parietal, occipital, temporal, zygomatic. So all these bones have sutures. This is like little joints, they move. So nice thing is bringing fingertips and press. You don't need to know where the sutures are, but trust your fingers and let your fingers guide you into those places, and you press, release a little bit. It feels very good for some people. How does it feel for you?
I notice I get a little bit more alert.
More alert.
And really gonna watch your fingers.
Okay, so this is a little bit intense. So I need to be more present with it. Maybe less pressure.
Nisarga, are you pressing with the thumbs or with all the fingers?
All fingertips like this. So okay. I want to create movement, a little bit of motion in those bones of the skull. Bring some relief, kind of relaxes the head. You could do some touch around the eyes also, so you can go into eyebrows just above zygomatic bone and track it down.
That's really nice and relaxing.
Very nice and relaxing for Mariam.
And really becomes present in a positive way.
And of course in the breathwork session, person might be in the full movement. So this can be done in the stillness phase, in the resource phase, where the person is more in stillness, because you need certain stillness for this.
Nisarga, what if you have fingernails?
Cut them off. It's a good question. I'm kidding, of course. Use your thumb like this, so you don't cut the skin. Yeah, or yeah, be mindful you don't.
It's acupuncture on the same.
Great questions. Okay, so this is kind of what you can do. You can do sometimes, it's nice, there's this bone here of the top of the nose and third eye. For people who has a lot of frowning in their forehead, like perplex or worries, like if you go kind of with the fingertip and gently push out, that's really relaxing for the brain. It's from osteopathy.
Push out.
In, like you stay in, but a little bit like this angle. Towards the skull, towards the brain. Yeah. And you hold it gently. And you take a few deep breaths. How does that feel?
It does feel relaxing, but I also realize that there is some tension there. But I already felt it earlier today.
And so it's both.
Yeah, but I can feel that the tension finds it nice and relaxing to be touched.
I went a little bit too deep, too fast, but if it's done because of the demo, I'm a little bit time concerned.
Mm-hmm.
But if you do it slowly and create the depth, you can go more into relaxation. Then we're moving into the jaw, so TMJ, mandible, and then mandible goes into TMJ, the temporomandibular joint. So this, when you move the jaw, this part is called TMJ, and there's a masseter running on the top of it. It's a thick, kind of square muscle on the jaw. You might have a lot of clients coming with this problem in the jaw, grounding their teeth or clenching teeth, having a lot of tension here. So how to find it? You can open a closed mouth, and it's closer to the ear. And when you put your finger, you will notice it's moving. Yeah, and that's the TMJ. So imagine on the top of it runs the muscle. So you can use your thumb to stretch all this area, this way or this way.
Is usually this stroke on the TMJ, do you find that it's more activating or more relaxing?
Could be both, depend how you do it. It could be very stimulating sometimes if you work with clients who has difficulty to express anger. Usually this area holds anger. And if you want to trigger anger for some reason, and you feel it's beneficial for the client and they need to go or they want to go into it, if you go into TMJ with the thumb and you keep pressing, you can do it yourself. You will see the blood pressure rises quickly and you get pissed. You get pissed, you get angry. Yeah, it's a sense of like fuck off. And you stay
You're waiting for it?
No, I still very light. I don't want to stimulate.
With the mouth open or closed?
Mouth can be slightly open, but some people would clench it. You know, just don't do it when somebody had already some injury operation in this area. But for normal condition, you can press one side or both sides, and that usually will stimulate. Deeper touch here will stimulate. But this can be very relieving, like more superficial, stretchy, like on the muscle. Yes. You can also work, because TMJ is very close to the, what's it called? Auditory foramen. If you look here, it's like few millimeters gap. So sometimes people with the hearing issues, there might be something in TMJ. So you can actually go into the inner ear, like 45 degrees, and you will end up on TMJ. Yeah, and like somebody, like with tinnitus, like if somebody has tinnitus, this ringing in the ear, this could be really good. So you go with the pinky, and you go to the foramen. It's okay, I go into your ears. You ask permission because it's quite intimate. And then you go in, and then you go 45 degrees towards the jaw, and close your jaw. Yeah, and then close, and then you will feel that it's moving. So you're on it, and you stay present, and let the client to breathe into it and release TMJ. And that really can help with tinnitus a lot. I had many clients who had a huge improvement with this stroke.
It can help with the tinnitus,
Yeah.
which normal medicine says is like unhelpable and stuff, and so it's like releasing the tension there also with the
Discharging the tension in the jaw.
Yeah, alright.
I don't know what it says, medical word about it.
You won't cure the tinnitus.
No.
Maybe somehow provide some penalty
Mm.
temporarily, but there's no cure for it.
How does it feel?
Now it feels nice. It was about 5, 6, but now it feels more spacious. I want to move.
Yeah. After discharge, usually movement comes with deep body work. So you do some stroke and you step out and there is some movement. You can work on this diaphragm here, mandible diaphragm, mylohyoid. It's kind of like a base of your tongue. That's where your tongue is attached. And you can just track it down the bone with fingertips. Is this pressure okay?
Yeah.
You can go deep, but ask for feedback.
So 2.
Huh?
A 2.
2, so I can go deeper. Again, like if you have nails, not recommended. Right? If you have nails, not recommended to give it to somebody. Because you make a second hole in your mouth.
Nisarga, in a session, normally, would you be doing any of that intense work during the session?
Yeah, I
Yeah,
could
you could do
not
it
all
right
of
in
it,
the
but I could do 1 or 2 stroke optionally, or some of
in the
it.
middle of a session?
Yeah,
Yeah.
not all of it, but otherwise it becomes bodywork. So
Yeah.
What you did at the beginning, was this the ocular valve that you were showing us at the beginning?
yeah,
Okay, and now you're showing us...
oral and cervical. I'll go now to the neck. So with the neck you can do SCM sternocleidomastoid, this muscle on the side. Lift your head. You see this cable? Very strong muscle, and you can stroke it from the mastoid process, which is behind the ear here, and go to clavicle and sternum. Sternum and clavicle. And then you stroke it, stretch it. And this will affect vagus nerve. Your 10th cranial nerve, the vagus nerve, goes from the brainstem and goes through the neck under SCM, under scalenus, goes under the clavicle, and then goes all around the heart, the lungs, the liver, stomach, intestines, all the way to pelvis. So this is where it goes.
On both sides or one
Both
side?
sides, both sides. 2 branches. So if you work on SCM, you also indirectly working through the brachial plexus, the big branch of nerves that goes into the arm, into the body. So be careful if you feel some pulsing or redness comes into the face and the neck. Take your fingers, then you're too deep. But it's about stroking and melting this muscles tissue rather than pressing too deep into the neck.
When you do all of this work, in the beginning of the session, before she breathes, or inside the session, or in the end for the relaxation?
During the session, not in the beginning. Beginning is more breath, sensations, movement, and then at some point when there's more stillness after a few discharges, 1, 2 discharges, where we start working with pendulation and there's some stillness, then you can bring body work.
And
in general.
Okay, when you do body work, you continue to have a she's relaxed.
Look, with some of the stroke you cannot breathe deeply. Like with SCM, if you work deeply, more shallow breath. So you slow down the breath at this point. It'll be too much. On TMJ also very difficult to breathe through the mouth deeply. So do you do it in the gaps where there's more stillness? Okay, maybe just one stroke on the other side. Nice to sometimes do strokes on the occiput, so at the back of the skull you sink in your fingers, and that's also kind of in stillness phase or integration phase. This is super nice. You sink in on the atlas, the first vertebra, between first vertebra and the skull, and you sink in and you wait. That's very relaxing. A lot of tension we hold there. That's pretty much kind of basic. You could do sometimes with the thyroid problem, or there's sometimes a lot of tension in the front of the neck. Sternohyoid, this muscle on the top of the trachea. So with some people, if they are okay with it, if there's, you can lean back a little bit, stretch, okay, and you can stretch this muscle and trachea. And breathe through the nose. Yeah. Sometimes this area can. So you find the hyoid bone, the floating bone, and from that bone down, you trace the trachea all the way to sternum. For some people, it can be too much, but how is it for you, Maria?
It's really nice.
It really opens whole front. You go towards sternum. And again, this is more in stillness. Yeah. You cannot go breathe deeply. Alright. Cool.
Demo done.
Next.